The nervous system is probably the second biggest system that I think herbalists tend to focus on. First, I would say would be digestion, always. Second would be the nervous system. And this is probably the area where we as herbalists get to have a really profound effect when choosing our healing plants. When someone is dealing with stress related issues and they go to contemporary medicine has really reduced the physiological issues like anxiety, depression, and insomnia to a simplistic issue of chemical imbalances in the brain. And the medical doctor will treat with pharmaceuticals that are designed to reroute a nerve signal pathway in order to alleviate a symptom or correct a chemical imbalance. Very rarely do they look at the emotional and spiritual factors associated with these issues. And so, this is where we as herbalists really get to take a holistic view and have a really gratifying effect on the individual. Now, before choosing herbs for the nervous system conditions, we have to take the time to get to know the person that we're working with. I remember back when I first started working with clients 11 years ago, and people would come to me and they'd say, "Oh, I have depression." And I'd say, "Ah, I know the herbs. I know the herbs for depression. No problem." And I would put a formula together and I would give it to them and they would take it home and nothing would happen. And same thing with anxiety and same thing with sleep. And I just couldn't understand why these formulas weren't working. It was like textbook formulas that I was putting together, and I just couldn't get it. Well, I realized later that I wasn't taking the time to really get to know this person and build a relationship with them and understand who they are at their core. And I'll be honest, this was not an area I was comfortable with. I'm a pretty logical person, and um, I like to say I'm sympathetic, but I'm not always super compassionate. And so I really kind of shied away from getting into anything emotional with people. And I realized I was doing my clients a really big disservice, and I was doing a disservice to myself by not allowing myself to get close to my client and really understand who they are. And so I encourage you to start to think about who is this person that you're working with. And I encourage you to do this regardless of what they're coming to see you about. Okay. So there's a lot of questions that you need to ask and think about when you're working with someone, especially when it's a nervous system related condition. So, first of all, who are they? Who are they? What, how do they show up in this world? What events have shaped their life, good, bad, or indifferent? What major events have shaped who they are? What things have shaped their belief system? What do they believe about life? What significant physical and emotional traumas have they experienced? And this is not something they're going to tell you on day one, right? They're not going to come meet you as a stranger and just reveal all of their deep emotional traumas. Now, some people might, but the majority don't. That's going to take time for them to figure out who you are and trust you. And so, this is something that we kind of work out over time. What makes them happy and joyful? And what makes their heart break? I had someone ask me a question one time that I really couldn't answer. And when I thought about it, it should have been a simple answer. They asked me, "What do you do for fun?" And it really about took my breath away. And I sat there for a really long time and could not come up with something that I did for fun. Now, this was at a time where I did still have really young children at home, and I was in what I call superwoman mode. I was an extreme workaholic. I still work a lot. I love to work, but back then I was compelled to work because I felt like I had to achieve certain things. And so my every waking thought was about work. And it was terrifying to realize that I didn't have anything that I did for fun. And so it's interesting when you ask that question, you're not only listening to their answer, but you're watching the individual. And how are they reacting when you ask certain questions? And what are they not telling you is as important as what they do tell you. What are they afraid of? So these are all questions that we have to be willing to ask. And then we have to be willing to sit quietly and listen to their story. We have to be willing to open up our heart to this other individual and allow them that space, that sacred, safe space to tell their story. Often this opportunity for them to tell their story will be a first time for them, and they may be really surprised by what they discover on their own and what resolves from the simple act of acknowledgement and honoring who they are and their life experiences. I will tell you that each and every one of us innately knows our own answers. We know what we have to do to change certain situations in our lives. We just sometimes need that safe space to speak it out loud, to reveal things that we're hiding from ourselves. And that only happens when we give someone that quiet, safe space to speak. And then we sit and listen. Now, to be truly healthy, we also must encourage our clients to seek health first through proper nutrition and movement. So many nervous system conditions subside simply through paying attention to these two aspects of life. When we deprive our body of nutrient rich foods, the brain and the nervous system starve, and our cells and nerves cannot function at their best level. If a person is experiencing anxiety, they may find great relief from the stress release of exercise. If a person is depressed, they might find that their mood lifts when they go and take a walk in nature. And never, ever, ever be fearful of speaking to them about their spiritual belief system and encouraging them to have a connection with something bigger than them. Now, I don't care if they call that God, the divine, the creator, the universe, whatever. I don't care what label someone gives it. The knowing that they have a belief system in something bigger than them gives them hope, gives them um, a system of guidance in their decision making. I have found that people that I have worked with that have no belief system tend to feel less hope. And we have a harder time getting through some emotional things because they just don't have the guiding compass that my clients who do have a spiritual belief system tend to have. Now, I'm not saying that's true for absolutely everyone. This was my experience with my clients. But I would encourage you to have to bring into the conversation their spiritual belief system. You know, in workplaces, we're told, oh, don't ever speak about religion or spiritual stuff. That's a taboo, right? But in this work, we have to, because a lot of our physical conditions have an emotional root cause. Now, herbal medicine can be an integrative tool that with benefits that are both physical and emotional. So we get the chemical um, compounds in the plant that give us physical medicine. And then we also get the spiritual, energetic part of the plant to work on the emotional body. Now, you can work with things like flower essences, which is a wonderful plant medicine for emotional root causes. And you're going to get a lot of that later in your course. And we'll talk about flower essences here and there. But understanding that even when we're giving a physical medicine, the spiritual part of that plant is still working. Even if you're not intending that, right? Now, it's much more powerful if you have an intention of that, but the plants know what we need. So keep that in mind that we have to look at everything. Often, when there's a physical condition, like let's take chronic back pain, okay? That sounds like a structural issue, right? So we would automatically think structural things. Well, if someone comes to you and they've had chronic low back pain for 7 years and they've been to every doctor and they've had every test and nothing shows being wrong and they've tried everything, we can really dig into when was the first time you remember experiencing this back pain and what was happening in your life within several months, say 2 to 3 months, right around that situation. And I will tell you, people can pinpoint it every single time. They will pinpoint a major life event that happened, whether that was a physical trauma or an emotional trauma. They will pinpoint it. And when you get them to talk about that event, often it's the act of acknowledging that event and their back pain starts to get better. It's fascinating. So I encourage you to have those conversations, really spend time with people, and then thank them for giving you the honor of hearing their story. I thank my clients every time I see them. Thank you so much for honoring me with your story, for trusting me to be a partner in this journey with you. I'm deeply honored by that. And I am extremely honored and grateful every time someone chooses to work with me, because that's a big deal to let me into the deepest parts of who they are. And, I often ask really hard questions that, that makes them uncomfortable, but I warn them, I'm going to ask you questions that make you uncomfortable. But they know that I hold that as sacred. I really give safe space for them to lay it all out there. And it's healing for them and it's healing for me too. Every single time I'm humbled. And so I encourage you to put yourself in a space to be humbled also. Now, I want to talk a little bit about the stress response first. You're going to get this in another lesson as well. So I'm just going to kind of be brief about it. But I want you to understand a little bit about what happens within the body when we experience stress of any kind. Okay. So I want you to think back to like cavemen times, right? And people had to go out, they lived in caves and they had to go out and forage for their food and hunt and all of that. And, they'd be walking through the woods and they come around a tree and there's a giant bear, right? And the bear rears up on its hind legs. And in an instant, that person has to decide, are they going to fight the bear or flee? Okay. So the body goes through a very specific response in that instant, which is called the stress response or the fight or flight response, right? So you have to decide whether you're going to fight or are you going to run away, fight or flight. All right. So in the instant that we are presented with a stressor, such as a bear, first, there are hormones and chemicals that are put out into the body to make some specific changes. The eyes are going to dilate to allow more light in so that we have very clear vision. So think about the last time you had a situation happen where you were really scared. We almost get like pinpoint sight. Everything gets super clear for an instant, right? So that's because the eyes are dilating and we're getting more circulation through the blood vessels of the eyes so that we have clear vision. Our heart rate will increase in order to push that circulation throughout the body and specifically to our limbs, our arms and our legs, so that we can either fight or run away, right? So that our muscles get more circulation and more energy. Our lungs will get more oxygen because of that increased circulation. So we get sometimes more rapid breathing, or our breathing gets much deeper. The other interesting thing that happens is we will get, well, currently, like at your resting rate, 85% of your body's energy is directed to digestion. 85% at any given time. That's resting. Now, when we come into a stress response, the body essentially turns digestion off so that it can shunt that energy to other systems of the body, the brain, the heart, the lungs, the muscles, so that we have the ability to get through that stressful response by fighting or running away. Okay. So think about that. 85% of your body's energy goes to digestion. That will shut off and be moved to other parts of the body. That explains why, when somebody has a really stressful situation, their digestion is upset, right? They either don't go to the bathroom, they get constipated, or they'll get diarrhea, or they'll get that feeling of a lump in their stomach, right? Because nothing's moving. It's a true physiological reaction. And this stress response, the fight or flight response, will happen even if the stress is a perceived stress and not a real stress. So, for instance, if you're watching a movie where there is a car crash, your body will go through this stress response as if you are the one in the car crash. Now, you're not, you're perfectly safe on your couch, but your body doesn't understand that because visually, what the images that are coming into your brain are of a car crash. So your body will go through that same response regardless. So that's perceived stress. Now, in a normal body, we have the stress response and then we recover, right? So you come up to the bear, you realize there's a bear, you decide to run away. The bear gets scared too, runs off. Stress is over. The body gets to recover. But in our modern world, we don't get that recovery time. We all live in a constant state of chronic stress. You wake up in the morning to an alarm clock. You're jolted out of bed. That's a stressor. You realize that you snoozed it 3 times and now you're running late. So there's stress. You get in your car and you're stuck in traffic. And now you're 20 minutes late to work. That's a stress. You work all day with people you don't like. The boss yells at you. You're stressed all day. Your job is hard. You get home, you have to throw dinner together. You get the mail, you open the mail, it's summertime, and you got a huge electric bill you were not expecting, and you don't have the money to pay for it. That's a stress. These are all bears, every single one of them. Not to mention things like relationship issues, or, um, you know, a parent dies, or a pet gets sick, or your child, your grown child calls you with their stress. We take all of these on. And so our bodies never really have an ability to recover. And so when we're in this constant state of stress, we can develop some chronic health conditions. And so, first would be cardiovascular disease. So, we can have emotional situations that lead to heart issues, and chronic stress leads to heart issues. So, we have epinephrine and norepinephrine and cortisol. All of these are stress related hormones, and they all can cause increased levels of blood cholesterol. And so while these chemicals are necessary for fuel during intense physical stress, prolonged chronic elevation leads to atherosclerosis, coronary artery disease, and stroke, as well as hypertension, which is high blood pressure. We can get digestive disorders. Well, of course, remember I said that 85% of our energy goes to digestion, and when we're under stress, that gets shut off. Well, when we're under chronic stress, and so digestion is always shut off, what happens? So, blood gets shunted away from the digestive tract and goes to the limbs, the brain, the heart, and the lungs. Digestive juices are decreased, which leads to poor breakdown of our food, poor assimilation of nutrients, and may lead to either constipation or diarrhea. It's a contributing factor in the development of ulcers, colitis, irritable bowel syndrome, and other inflammatory bowel conditions, which we talked about in the digestive section. We can get immune dysfunction. Again, chronic elevated cortisol levels, that's your stress hormone, decreases our resistance to infection by suppressing the immune and the inflammatory responses. Frequent infections, poor wound healing, allergies, chronic fatigue syndrome, and even cancer are reflections of chronic high stress. We can have thyroid and sexual imbalances. During periods of stress, the body increases production of TSH, which is thyroid stimulating hormone, and ACTH to provide the necessary amounts of cortisol from the adrenals. Increasing these levels can decrease sex hormones and result in low libido, impaired fertility, erectile dysfunction, and even inability to orgasm. When I'm working with people who have chronic stress, I'm always paying attention to their thyroid function, because thyroid and the adrenal glands go hand in hand, and then looking at their sex hormones. So if it's a female, it's their estrogen, progesterone levels, and testosterone in a man. Now, women produce testosterone as well, just not in as much, and men produce estrogen, again, not as much as women do. But what is happening with all of these hormones? Okay, there's like a whole loop of hormones that can become out of balance. Blood sugar problems can happen. So, increased blood sugar is important for fuel during acute physical stress, but a constant hit means the pancreas has to deal with elevated blood sugar levels all the time that are not being used by the body. And so, initially, this might result in hypoglycemia, low blood sugar, due to increased insulin production, but then it could lead to insulin resistance and then metabolic syndrome and prediabetes. And then we have adrenal insufficiency. Our poor little adrenal glands, they're the hardest hit during chronic stress. And the adrenal cortex and the medulla of the adrenals begin to struggle or become fatigued. Symptoms of low adrenal function include low blood pressure, poor circulation, low resistance to infection, and digestive disturbances. Now, all of this is in your handout, so I hope that you didn't feel like you had to write every single thing down, but this is all in your handout for you. Now, a holistic approach to these complaints would address these issues with nutrition first, always, always, always. Nutrition first. And then herbs that are specific for the particularly affected systems. And we must also consider the function of the nervous system by looking at adaptogenic herbs, which you're going to be learning about in another lesson, nervines, relaxing therapies, and stress management. So we have to look at this in a complete holistic way when we're working with someone. Now, we have three major classifications of nervines. Nervines means herbs that work on the nervous system. And so what we're going to go through today are the classifications of these herbs, and we're going to talk about some specific herbal therapeutics, and then we're going to go through a few conditions. Okay. So we're going to talk about nervine tonics, nervine relaxants, and nervine stimulants. And then there's some other actions that are useful in the nervous system that are also called nervines. And so those would be hypnotics. Those are things that put you to sleep. It's different, not hypnosis, it's different, right? So we would call hypnotics those things that put you to sleep. Antispasmodics, super important. Analgesics, those pain relieving herbs. Antidepressants, anxiolytics, so anti-anxiety, and adaptogens. Okay, so first we're going to talk about nervine tonics. So tonic being herbs that bring tone and structure and function back to tissue or organs or systems. Okay, that's what a tonic does. And these are typically things that can be taken daily and long term. They're typically very, very safe when we say something is tonic. So the first one we're going to talk about is Scutellaria lateriflora. This is skullcap. And the parts that we use are all the aerial parts above ground. This is in the Lamiaceae family, which you can sort of tell by looking at that picture. And this has actions of being a nervine tonic, an antispasmodic, hypotensive, sedative, trophorestorative, which means that this plant has the ability to rebuild damaged nerve fibers. That's really important. Okay. And it's anti inflammatory. Now, I would choose Scutellaria when there is nervous fear. This person will be very restless. They might have a lot of restless sleep. They may get some cardiac irritability or like heart palpitations. They might get muscle spasms or eye twitches when they're stressed out. They might have an inability to pay attention to things. Their mind is kind of jumping all over the place. Like if you sat in front of the TV and just kept clicking the channel and changing the channel over and over again, that's what their brain might seem like. Maybe this person experiences headaches, and their headaches are dull headaches in the front of the head or at the base of the brain. They might have headache symptoms that get worse with noise, worse with odors and light, but get better when they can rest. Okay, so that's a picture of this individual. Some conditions that this person might have might be irritable bowel syndrome, that maybe they can pinpoint certain emotionally charged situations that would make that worse. Maybe they experience seizures, a variety of muscle twitches, like maybe restless leg syndrome, Parkinson's disease. There's a lot of muscle spasm in that condition, and degeneration of nerve fibers in the brain, cerebral palsy, and epilepsy. So these are all conditions that I would immediately begin to think about bringing in Scutellaria. Again, Scutellaria lateriflora, which is skullcap, very different than Scutellaria bicalensis, which is Chinese skullcap. That's typically an immune herb. Now, in your 300 Herbs book, Matthew Alfs states that the most antispasmodic effects come from fresh plant tincture and that dried plant tincture is virtually ineffective. However, David Hoffman in Medical Herbalism promotes dried preparations with great success. So I bring this up because I think it's important for you to understand that each author is going to write what they know and what they have experienced, and it's important for you to experience it on your own. So I would encourage you to sort of do a research project. If you're going, let's say you do this with Scutellaria, get a tincture from fresh plant or make one your own if you have access to fresh Scutellaria, and then make a tincture from dried Scutellaria and try them both and see what you think. Do you feel that there's a difference between fresh or dry? I tend to use a dry plant tincture often because I'll make my own. Um, but if I'm going to use a prepared one, like from my company, Wise Woman, that's a fresh plant tincture. I like them both. I don't necessarily see too much difference in that. And that's just me. So I would encourage you to do that. Now, this is contraindicated in pregnancy, and it may potentiate the effects of some sedative medications. So if someone is taking something like, oh, what are those sleep? Um, Ambien, right? Or any kind of a really heavy sleep medication, they may sleep longer. So you have to kind of be careful with that. Okay. All right. Next Nervine tonic is Avena sativa. This is oats. We typically will, when we're tincturing, we'll typically tincture the milky oat tops or those seed heads when they're fresh. So fresh and milky if we're going to tincture. But you can do the whole plant. You can do the oat straw. Typically, if we're doing tea with it, we're using the oat straw, which is the dried oat straw. But tincturing typically is the oaky or the milky oat top. Okay. This is in the Poaceae family or the grass family. And we get a lot of proteins in oat, flavones, vitamin E, and some starch. The oat grain from the ripened seed is high in protein. The oat bran contains fiber, and the oat straw is high in silica. It's also rich in lysine, B vitamins, calcium, iron, manganese, and zinc. And along with being a nervine tonic, this is antidepressant. It's nutritive, of course, and it's demulcent. It's a vulnerary, and it's an anti-addictive. So what that means is it really kind of feeds the connections in the brain, also tropho-restorative, um, and helps to repair damaged tissue from substance abuse. Okay, damaged brain tissue. Um, this is really great for that person who is just exhausted, right? They're just really worn down physically, emotionally, mentally, just done, right? They're just worn out. This person might experience a lot of fatigue, depression, insomnia, sometimes irritability. Um, think cold, inactive, just blah, right? Um, Low libido, maybe because they have an inability to relax. This is often what happens with women, but men experience that situation for low libido as well, um, where worry gets in the way and you just can't mentally get into that space. So oat really kind of dials the brain and the nervous system down a couple of notches so that we can begin to feel that way again. Um, Good for people that have a lot of headaches, occipital headaches specifically, premenstrual headaches also. or anytime that they get nervous. Okay. Nervous heart palpitations, um, and just really thinking like this person just really needs some nourishment, right? This person needs to nurture themselves, like emotionally as well. Avena does that really well. Now, there's no contraindications, but a lot of times you'll hear that people with celiac disease should not use oats because of gluten. Um, and I just kind of want to clear this up a little bit. So, Avena sativa oats does not naturally contain gluten. What will happen is the oats are often milled on the same equipment as other grains that do contain gluten. And so, like if you're going to buy oatmeal, for instance, it will have been milled on the same equipment that wheat and barley and rye may have been milled on. And so you have the instance of cross contamination. And so that's why people with celiac disease are cautioned to only use certified gluten-free oats. Now, someone making herbal medicine from the oat, whether it's a company or yourself, you're typically going to harvest those fresh, milky oat tops yourself, and then they're going straight into your jar. So there is no cross contamination there. So I just want you to understand why that gluten issue is brought up around oats and that it's typically not a concern when you're using, say, an oat tincture. Okay. Now, oat straw milled somewhere, that might be different. And so you can always call companies and ask ask them, is it gluten free? How, is it done on other equipment with other allergens, that kind of thing. Okay. Another nervine tonic, Hypericum perforatum. This is St. John's wort. And we use the flowering tops of St. John's wort. And the main constituents in this are hypericin and hyperforin. Along with being a nervine tonic, this is also sedative and a nerve tropho-restorative. This plant is specific for injury or damage to nerves, whether that comes from a physical trauma or injury or from a virus like, let's say, shingles, which resides in nerve fibers. Okay. This plant is also very antiviral, specifically for the herpes virus and shingles being a herpes type of virus. So adding this to a regimen for that greatly reduces the intense nerve pain that can linger for months. But I would use this anytime there is nerve issues. So I give this if someone is having dental work done, where there could be some nerve problems. And then this goes in a lot of my formulas for anxiety and depression. This is often called the depression herb, St. John's wort, and mainly because it's the one that they chose to put a ton of money behind in studying it. Okay. I will be honest with you, I don't find Hypericum effective for depression on its own. I just don't. I think there's many other herbs that do that better. But when you put this in formula with other herbs, we get some really nice synergy. But to use it by itself, I haven't found it to be super effective. But what I do use it for is, like I said, things like tooth pain or shingles or someone having pain after any kind of a surgery, um, hemorrhoid pain, um, things like that. Um, I also have concern with this plant because this is probably one of our herbs that has the most negative herb drug interactions. So the reality is that a lot of people who come to see you are going to be on some kind of pharmaceutical medications. And this one interacts with a lot of them. So there are many times that even if I want to use this herb, I can't because of what medications they're taking. And it's, heart related medications, blood thinners, things like that. So it's not things that they can just not take their medication, right? So we have to find alternatives. So kind of keep that in mind. I always recommend you have an herbal PDR on hand. You can get a great one on Amazon, and it's PDR of herbal medicines. I love that. There's also the Botanical Safety Handbook, and I know I've mentioned these before. Those are really great to have so that you can look these herbs up and cross reference with any medications that someone is taking. Now, the person that I would choose this for would be someone that really just doesn't know their worth. They might actually say that they feel worthless, that they don't feel like they matter. And so what's interesting is that St. John's wort loves to grow right around yarrow and Queen Anne's lace. You'll often find them all together. St. John's wort doesn't do well growing by itself. If you were to try to cultivate this all by its lonesome, it's going to suffer. It needs that community of those other plants around it for it to really thrive. So, what does that tell us about us as individuals? If this plant needs community to thrive, then we as individuals also need community to thrive. And so, this would be the choice for someone who is isolated or feels isolated. And it might be self imposed isolation, right? They get depression and they withdraw. That's fine. It doesn't matter where the isolation comes from. But that's when I would think about hypericum as part of their formula. This is also contraindicated in pregnancy and again with concurrent use with many medications. So make sure that you're cross referencing that. Now, topical application of hypericum, let's say you were putting it topically on shingles or anything like that, there's no issue with topical application. I'm talking just internal oral application. Okay, another nervine tonic, Verbena officinalis or vervain. Common name vervain. This is in the Verbenaceae family. And there's a lot of essential oils in this. It's a very aromatic plant. There's mucilage in here and iridoids. Along with being a nervine tonic, it's sedative, it's antispasmodic, diaphoretic, hypotensive, and it's a gentle anxiolytic. And so this would be indicated when there are nervous symptoms due to mental or physical overexertion with spasms, especially in the neck and back. So think a lot of neck and shoulder tension that might result in headaches. This individual is probably a very strong willed person. Like they're just going to push through, right? And so, they're going to experience all this tightness and this pain that comes from the tension, but they're not going to give it any thought, right? Because you just got to live life, you just got to do what you do, and you can't let it slow you down. That's who this individual is. This also might be a beneficial antispasmodic in seizures. So kind of keep that in mind if you're working with somebody that has a seizure disorder. Contraindicated in pregnancy. Now, oftentimes when we say contraindicated in pregnancy, it doesn't necessarily mean that you absolutely can't take it. It means that we don't know with 100% certainty that it won't be harmful. Because who's going to study on pregnant women? That's just not ethical, right? We don't want to do that to pregnant women and the unborn baby, right? So there's a lot of things we just don't know. So we'll say not for use during pregnancy. Now, there are times where we'll say don't use during pregnancy because it's an abortifacient, which means it's been known to cause um, miscarriage, right? Abortifacient, right? Um, or don't use because it's a uterine stimulant. which could cause premature birth, right? So when we know an exact reason, it's disclosed. But when we just say not for use during pregnancy, that often means we just really don't know. Okay, so just kind of keep that in mind. Um, okay, let's see. Now we're going to go into nervine relaxants. So here comes Scutellaria lateriflora again. So it's a nervine tonic, but it's also a relaxant. So that means it's going to calm things. It's specifically calming in the nervous system. And so I think I mentioned to you when we did the herbal flavors and energetics class, um, my experience with passion flower as a way to calm my panic attacks, right? Well, I kind of have built the same relationship with Scutellaria for nervous tension and twitches. So I will, when I get super stressed, I'll get this, my right eye will get this weird little twitch, drives me insane. And I love Scutellaria for that because it very quickly calms that spasm and lasts quite a long time before I have to take it again. I'm like, 6, 8 hours. So I might take that twice a day and get rid of that eye twitch. Valeriana officinalis, this is valerian. We use the root of valerian. Now, any of you who, if you have ever used valerian, you'll know that valerian has a very distinct smell. And often people will call it, they'll describe it like the smell of sweaty gym socks, right? And that's how you know it's good valerian. Like you can smell that just smelling the flower too. It has that very distinct aroma. That's good valerian. This plant has a lot of amino acids in it, a lot of tyrosine. There are 17 sesquiterpene lactones in it, and these are considered the primary source of its pharmacological effects. Some commercial products are standardized to the valerianic acid content, which is a sesquiterpene that exists nowhere else in nature except in valerian. Its actions are sedative, again, nerve relaxant, anticonvulsant, and hypotensive. Now, I choose valerian when there has been a big shock. So someone just went through a situation or heard some news that was completely shocking. And it's so shocking that they almost can't function. Okay. So the death of a loved one, that's a shock, right? Um, a car crash, anything big like that, that kind of stops the whole system. That's when I think about valerian. Now, some people will think about valerian specifically for sleep, right? You hear that a lot, that valerian is useful for sleep, and it is in about half the population. So it's a fantastic herb for insomnia, but there are half the people that for some reason are very stimulated by valerian. So I would always recommend you give valerian in the morning time first and let them see how it affects them. Because what you don't want to have happen is you give it to them at night for insomnia and they're awake for days, right? So it's just a weird thing that happens, and I have no idea why, what is going on in that particular individual that makes them react to valerian that way. Not sure. But what I also use valerian for is for its nerve related relaxation and nourishment. And so this also will become part of my shingles protocol. Really great for that nerve pain. Now, again, I would have people take it early in the day. If they are stimulated by valerian, I would not have them take it past, say, 2 o'clock, but is really great in a virus like shingles or chickenpox, things like that. Now, it is because of its GABA receptor activity, Long-term use of valerian could result in withdrawal symptoms. So kind of keep that in mind. If someone is on valerian every day long term and they decide they want to stop valerian, you're going to have to wean them off of it. Short term use, typically not an issue, and so when we say short term, we say, that's typically less than 6 weeks. Okay. But it would depend on the dose that they're taking, the frequency, that kind of thing. And so even if they were on that for, say, 6 weeks, I would still wean them off a little bit. If they've taken valerian for a week and then they stop, that's fine. But if they're on it for any kind of time, I would say wean them off. Nervine relaxant, Leonuris cardiaca. This is motherwort. And motherwort is really great when nervous system or stress related situations have an effect on the heart. So maybe they get really high blood pressure, maybe they get the heart palpitations, maybe they get constriction in the heart, a tightness in the chest. Anything related to the heart area during stress responses, Leonuris is fantastic and really protects the heart muscle and the blood vessels of the heart, um, and hopefully preventing leading to cardiovascular disease, right? I also use this when there is a lot of worry, um, sort of like how um, a mother worries about her children, right? It's that kind of constant um, obsessed worry and feeling responsible. So this person probably feels responsible for a lot of people in their life or things in their life. Um, and so Leonuris would be a really good choice to add into a formula for that person, whether they're male or female. We really need to protect the cardiovascular system, but also kind of loosen that tension on the emotional heart, right? Mom's worry, dad's worry, grandparents worry, whatever it might be, whoever they're worrying about, whatever they're worrying about. When there's that constriction in the chest, Leonuris is perfectly indicated for that. Another nervine relaxant is Piper methysticum. This is kava kava. We use the rhizome of the kava, and it contains a lot of what are called kava lactones. And so this is a relaxing nervine. It's also hypnotic, antispasmodic, and it can be a local anesthetic. This is a great anxiety remedy that does not dampen the mental alertness when we give it in therapeutic dosages. So a lot of times when we give something that's a relaxant, it it calms the system so much that maybe they get drowsy or they just don't think as clearly. Maybe they get a little foggy. Piper doesn't do that. And so we really have an ability to give good amounts of Piper, and still have some really good mental clarity. The effects of Piper compare with the effects of pharmaceuticals without the negative side effects. It actually appears to improve concentration. So this can be used as a mild antidepressant. It's great for muscle pain and tension. Um, it works good as a local anesthetic on mucous membranes for dental pain and good for insomnia. I also use this anytime there's muscle cramping, like in uh, menstrual cramping is fantastic. Um, and when I'm working with someone who maybe they've had some kind of an injury where there's a lot of muscle pain, this is great for after an injury. Or they just overexerted themselves in exercise or something, and you need to like relieve that soreness in the muscles. This is nice for that. Now, there are some safety considerations with Piper, and it really stems around liver issues. You're going to read a lot about liver problems that can happen when taking Piper methysticum. Um, and that really comes from the way that kava is prepared. So traditionally, kava would have been made into a tea and drank as a community beverage. And it gives a very euphoric feeling. So if you've never experienced kava, it's really interesting because it gives you that very euphoric, relaxed, peaceful feeling. Um, and it's wonderful. And so you see all these like kava bars that open up, right? And so why do we have so much information about liver damage when we know that for centuries communities have used kava as a traditional community drink? Well, when we started to extract kava in alcohol, we then begin to access alkaloids that are not present in a water-based extraction. Okay, so if we decocted this, we can't access these alkaloids. They're called pyrrolizidine alkaloids, or PAs for short. It's these PAs that can have a damaging effect on the liver. And there are many plants that contain PAs. Um, so it's all a matter of preparation. Now, does that mean I don't use an alcohol-based kava? No, I still will. I will still put kava into a formula, but it's not something I'm going to give to someone every day long term. I will choose a different way of preparing kava for them if I want them using kava long term. Kava capsules would be fine. You're not going to access the alkaloids taking a capsule of powdered kava. Um, a kava glycerite would be nice because while glycerin can extract a lot of things that alcohol does, it's not as good at extracting those alkaloids. Okay. So those are a couple of preparations you could use long term. And then just use your alcohol based for short term use. Now, heavy consumption of kava can also cause what's called kava dermopathy, which is a skin rash. It's non-inflammatory, but it causes dryness and scaling. And this is typically seen in really long-term, heavy users of kava. And it will reverse itself when they stop taking kava. Kava might also potentiate substances that act on the central nervous system, like alcohol, barbiturates, and other pharmaceuticals. Another nervine relaxant, Hypericum perforatum. So it was a tonic, it's also a relaxant. So kind of go back to your notes on Hypericum for all of its uses there. And then we have Artemisia vulgaris. This is mugwort in the Asteraceae family. And along with being a nervine relaxant, it's also a bitter tonic and a vermifuge. Um, its only noted indications are for regulating menstruation. However, clinical use has shown mood balancing and antidepressant action. And I like this a lot when um, stress related things affect digestion because it's a bitter tonic, right? So, bitters stimulating the digestive processes, the digestive juices, gets things moving again, right? So, when stress related conditions affect digestion, think of Artemisia vulgaris. Now, again, this is also a time where species matters. So, this is Artemisia vulgaris. We also have Artemisia absinthium and a couple of others, and they're all used a little bit different. They might contain some of the same chemicals and we can interchange them for certain things, but they're all a little bit different. So species matters. So this is mugwort, Artemisia vulgaris. This is Passiflora incarnata, and this one is fantastic for that anxious mind. The person that you think of for passion flower might get panicky, like all of a sudden they like don't know what to do, right? Because like like they're having a panic attack and they just can't think about what to do next. But even more subtly than that, this might be a person that they go to bed at night and they lay there for 2 hours and can't go to sleep because everything about their day has to replay in their head, or everything about the last week or the last month or their entire life has to run through their head when they lay down. That's someone that I would give passion flower to. Now, it also is mildly pain relieving. So, fantastic when there is any kind of pain that is associated um, with, reasons why they can't sleep or reasons why they might be having anxiety. This is a fantastic one. And then Matricaria recutita, which is German chamomile. I've talked about chamomile a lot in the digestion section. Love chamomile. Very easy to get people to take because it has a nice, mild, sweet flavor. Along with being a relaxant, it's antispasmodic, it's anti-inflammatory, analgesic, antibacterial. So we have a lot of uses for Matricaria in a lot of different body systems. So I talk about this in the immune section, I talk about it in digestion, and now we're talking about it in the nervous system. And it's also carminative. So that's where we get the digestive action in there. This decreases inflammation in the nervous system. And it's a mild sedative when someone experiences nightmares when they're very stressed. Okay. Maybe menstrual cramping, a lot of anxiety. This person that Matricaria is for can tend to be whiny when they don't feel well. So think about a toddler, right? So a toddler who gets sick and their cheeks get red and they pout and they whine and why won't you pay attention to me, right? That's matricaria. So when you're working with someone who kind of gets like that when they're stressed or when they don't feel well, I would always look to put chamomile into their formula. Now, this is in the Asteraceae family, so if somebody has an allergy to that family, you would want to choose something else. Melissa officinalis, this is lemon balm, wonderful nervine relaxant, and I think lemon balm is more of an herb for depression than St. John's wort. Personally, that's just been my clinical experience. I love how lemon balm lifts the spirits. It's sort of like you wake up on a cloudy day and you just feel gloomy, and you take some lemon balm and it sort of pushes the clouds apart so the rays of the sun can shine back down on your face. And then you get to take that deep breath and sigh, and feels so good, right? That's how I imagine Melissa. And so when I'm working with someone who just feels gloomy, then Melissa's going to be it. Now, the only thing that I have concern with about Melissa is daily long term use in people with hypothyroid. Melissa can decrease thyroid function. So if they already have hypothyroid, we don't want to decrease that anymore. But it's similar to the same effects that a person can get by eating raw kale every day or raw broccoli every day. Anything in that Brassicaceae family, those all lower thyroid function as well. And so if someone is hypothyroid, they can still take Melissa. They're just not going to take it every day for longer than, say, 2 to 3 weeks. You might kind of rotate it in and out. Okay. And if they're having low thyroid and depression, and they're eating a lot of raw vegetables, and some of those things are broccoli and kale, then they don't have to stop eating broccoli and kale, but they do need to cook it. Okay. And so that's inactivated when those things are cooked. So just something to think about. This is tilia or linden flower. And you can actually use the flower and the leaves of linden. And there's a lot of volatile oils in here. It's got mucilage, there's quercetin, along with being a relaxant, it's diuretic, stomachic, antispasmodic, antidepressant, and calmative. And so this one's really indicated for nervous tension. Um, any, I also use this when there are stress-induced ulcers. Okay. Um, or when stress raises the blood pressure. Okay. That this person gets hypertension in stressful situations. And then as soon as the stressful situation's done, it comes back to normal. Heart palpitations that are due to stress. I like tilia when there is unresolved grief. And so a person will feel that as like constriction in their chest, or they might get visibly emotional when they talk about certain situations. So, gosh, it's been 3 years now. I lost my dad to cancer. And, I kind of thought my dad was just going to live forever. He was invincible. And then he got a cancer diagnosis, and 8 months later, he passed. It was very fast. And it was, let's see, it's been 3 years now, and it really is just in the last 6 months that I can talk about him without having a complete emotional breakdown. And so Tilia was really important to me when um, all those emotions were just so raw. And that was the way I would explain it. People would say, "How are you doing?" And I would say, "I'm just raw." Like the littlest thing said, and I would just lose my shit, right? Like I just like, and I'm talking sobbing in the checkout line at the grocery store with complete strangers around me for no reason. I went to go buy some chips, and I grabbed a bag of barbecue chips and then thought, oh, I should get two, because I always bought two bags because whenever my dad would come over, he loved barbecue chips and he'd eat one of my bags. So I always bought two bags. So dad had a bag. And so that day I went to grab a second bag and realized I didn't need a second bag. I completely lost it in the chip aisle. Like sobbing mess in the chip aisle. It was ridiculous. And so I was like, oh man, I think I need some Tilia. So it was really helpful. So think about that very raw grief. Okay. Thank you for letting me share my Tilia story. Okay, now we're going to move into nervine stimulants. So there are times where we need to activate some movement in the nervous system. Okay, and so we look to stimulants to do that. And so this first one is ginkgo biloba, common name ginkgo. It's in the Ginkgoaceae family. And so there's a lot of terpene lactones, ginkgolide, A, B, and C. Um, there's quercetin, camphorol, and a bunch of other things in here. It's anti-inflammatory and it increases peripheral blood flow. It's also considered a cognitive enhancer for dementia because it increases that blood flow to the brain, which is what is missing in a condition such as dementia. And so we look to ginkgo whenever there is deterioration of the mental state or deterioration of memory, focus, any kind of cognitive impairment. All right. It's useful for vascular insufficiency in the brain and the limbs. So that means you would think about ginkgo biloba when there are, say, varicose veins in the legs, or maybe the ankles swell often, because there's not that movement to move that fluid out of the legs, and so ginkgo biloba would be a good choice there. Maybe there's poor wound healing. Think about people who have diabetes and they get decreased blood flow to their limbs, specifically the feet. And so they'll get wounds that just don't want to heal because there's not enough circulation to heal. Also useful in retinopathy, vertigo. This is fantastic in vertigo. So I would say it was about a year ago I had my first ever vertigo experience. It was so disconcerting. And thankfully, I had ginkgo right on hand. And so I right away started taking ginkgo. And I think the vertigo really, like in a bad point, really only lasted about an hour. I was a little off the whole rest of the day, but I took ginkgo probably 3 times that day. And I think that was really what helped me kind of get through that vertigo quickly. And by the next day, I was feeling much better. There's also information on using ginkgo biloba for tinnitus, which is ringing in the ears. I've tried it for that for my own. I've had ringing in the ears since I was in my early 20s, right around the time I got diagnosed with hypothyroidism. And I've never found anything that has helped my tinnitus. So, if you have experience with ginkgo and tinnitus and it has worked for you, fantastic. I bring it up only because you're going to read about it, but like therapeutically, it did not work for me. So, if you have a different experience, I'd love to hear it. Contraindications, it does increase bleeding time. So use this with caution with anticoagulants. If someone is using this and they're going to have a surgery, then they have to stop this 1 week before the surgery. And it may prevent ovulation. So if someone is actively trying to get pregnant, this might not be the best choice. Another nervine stimulant is Centella asiatica. Common name is Gotu-kola. This is in the Apiaceae family. It's anti-inflammatory. It's also adaptogenic, analgesic, and a circulatory stimulant. This is really great also to accelerate wound healing time. So very useful for people who have wounds that are slow to heal because of decreased circulation. But this also helps to decrease scar tissue buildup. So this would be useful to be giving orally and using topically after a surgery or some kind of an injury where it might build up scar tissue. Helps to improve memory and is useful for sluggish digestion. So remember back, we talked about digestion being turned off, the energy to digestion when we're under stress. So Centella helps to bring energy and circulation back to the digestive tract in order to improve digestion. Useful for stress induced ulcers, high blood pressure, and a variety of nervous disorders. Contraindicated in pregnancy, though. This is Eleutherococcus senticosus, or common name Eleuthero. You'll also read about this being called Siberian ginseng. That name was changed, oh gosh, back in the 90s, I think. Might have been in the 80s they changed the name, but a lot of people will still refer to this as Siberian ginseng because it has a lot of the same actions that ginseng does. Improves endurance, improves focus, energy, stamina, mental clarity, uh, really gives a nice shot of energy without feeling like you just drank a 5 hour energy, right? It doesn't feel like that. It's a nice feeling. This is great for people who are very physically active. So this plant was first studied in the Soviet Union on their athletes, their Olympic athletes, as a way to improve their stamina and endurance and help in recovery from exercise and physical exertion. And so this is a great adaptogen for very physically active people. Okay. Um, Now, I would caution using this as a way to just continue to push, right? So if you're exhausted and you legitimately just kind of need to rest and chill, but you feel like you're not allowed, and so you just want more energy, you can get a rebound reaction. If you're using this every day, and you're not changing your lifestyle to mitigate stress in some way, you will have a rebound reaction from this. So it might give you increased energy for a while, and then you're going to crash. Okay. So I caution this with all adaptogenic herbs. Adaptogens being those things that help us adapt to and recover from stress. A lot of them increase energy and increase mental output, right? So we can think better, we can work harder, we can work longer. But is that really what's best for us? And so if we don't look at our lifestyle, like I mentioned earlier, me being at a time where I was in superwoman mode, right? And I just felt like I had to go, go, go and achieve. What I really needed was to learn how to slow down and love myself and love my life and realize that even if I sit down for 5 minutes, that doesn't mean I'm lazy. It means that I need to sit down and rest for 5 minutes and that every normal person does that, right? So I took Eleuthero for a time frame and had a rebound reaction, and it was not fun. So I just want you to be aware of that with all of our adaptogens, that we have to work with people to find ways to reduce stress and to reduce their reaction to stress in their life and to find a more sustainable way of living. This is Panax ginseng, Asian ginseng. There's also Panax quinquefolius, which is American ginseng. Very similar in the way that they work. Asian ginseng, the Panax ginseng, is more stimulating than the American ginseng is. So just, same kinds of things that Eleuthero, right? But the ginsengs also are really great at modulating the immune system. Okay. So when this person is um, overstressed, overworked, and is experiencing low immune response, ginseng is a nice way to build back up their internal life force, their fire. Okay. Another stimulant that probably every single one of us uses is Coffea arabica, coffee, the coffee bean. That is medicine, just not in the amounts that we in America take it, right? So, um, the coffee bean is a nervine stimulant and it's a bronchodilator. And so, this is indicated when there are headaches that come from not enough circulation and not enough oxygen. And so this is really great for people who have exercise induced asthma and maybe they get headaches that come from that. Okay. So my daughter, when she was young, she was playing soccer, but she had exercise induced asthma. And so I would make a really strong thermos of coffee. It was close to espresso. And I would take that to the field with us. And when her chest would start to get tight, she'd come over and she would take 2 sips and then she'd go back out and play. And those 2 sips would be enough to open up her lungs so that she could breathe more. Now, when we drink 2 cups of coffee, we don't get that same response. So when we drink coffee, we get immediate increased mental alertness and better focus. But we can hit caffeine toxicity at 1/4 cup of coffee. So here in the United States, we drink these large cups of coffee and we drink several of them. That's not how the rest of the world drinks coffee, right? because they understand that we don't need to be overstimulated like that all the time. But here in America, we feel like we have to go, 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 go. So we need more, 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 more. So I want you to think about that when you're doing coffee. Technically, we should be drinking just a small amount of coffee to give us that increased stimulation, and then that's it. Um, okay. Camellia sinensis. This is the tea plant. This is where we get green tea, white tea, black tea. Everything that's tea, technical tea, comes from Camellia sinensis. And so it's all in how it's prepared is how we get white or black or green. This is a nervine stimulant. It's also an anti-tumor, antioxidant, and anti-mutagen. And so we can use this for headaches and mental fatigue, um, because if you drink green tea, you know it has caffeine in it, and so we get that alertness. But what I tend to use Camellia sinensis for even more is support when people are going through cancer treatment, um, or whenever we need to correct some atypical cell mutation. And when we talk about women's health, we'll talk about this plant again, but things like abnormal cells in a pap smear, okay, or leading to cervical cancer. So the way those cells change once we get an abnormal pap, okay. So I think about green tea for that. Large doses can cause, again, caffeine toxicity, because we do have caffeine in there. Um, there's a green tea solid extract that I use often, from Wise Woman Herbals. It's a very concentrated green tea. It does have caffeine in it. So if someone's super sensitive, I don't give it to them. But I will use that um, for the catechin content in Camellia sinensis, in the green tea specifically. So you probably heard green tea beneficial for cancer, but you need to drink 8 to 10 cups of green tea a day. Well, green tea is really drying, very astringent. If you've drank green tea, you'll know because you take a sip, and if it was steeped too long, it's very astringent and bitter, right? So you need to add some demulcents to it to balance that out. But still, most people are not going to drink 8 to 10 cups of green tea in a day because not only is it too drying, but there's too much caffeine in it. Different than coffee caffeine, sure, but still, that's a lot of caffeine. And so I like the concentrated solid extract because I can give someone a quarter of a teaspoon of the concentrated extract, and they will get the catechin content of 8 to 10 cups of green tea in that 1/4 teaspoon. And they can even take that quarter of a teaspoon and mix that into hot water and make a green tea and drink it, or they can just take it straight off the spoon. I love it. It's so good. And so kind of keep that in mind. And I've used it topically as well on some skin lesions. And then there's other conditions in the nervous system. So we're going to talk specifically about a few conditions. Anxiety. So anxiety is the perceived threat of the future, right? Worrying about what will happen, even if it hasn't happened already, right? That's anxiety. We worry about what will or might happen. Um, in anxiety, there's a feeling of impending doom and a feeling of inability to be worthy of what is to come, or unable to cope or be successful. Physical feelings of body discomfort, um, physically feeling like the skin is crawling. I experienced that a lot and still do periodically. Like all of a sudden, my scalp will feel like there's bugs crawling on it, and there's not bugs. I've had my husband check, I promise you. But that's when I go, oh gosh, okay, I'm having some anxiety that, I was ignoring other symptoms of, but the skin crawling got me, right? Um, when someone has anxiety, to anyone else, there's no recognizable basis for the fear. And even to that individual, they'll say, I don't know why I'm anxious. I just am. Right. So there doesn't have to always be an exact trigger that they can recognize at that moment. So panic attacks sometimes are brought on from a situation that might have happened a week ago or 2 weeks ago. And it's sort of like the nervous system just kind of got kicked in overdrive and it's just now showing up. Um, it may manifest as panic attacks, which can resemble heart attacks and even in seizures. So I had a situation, a panic attack that sent me to the emergency room. I spent probably 4 hours first trying to do every herbal combination I could think of, yoga, meditation, deep breathing, everything that normally would work. And then my um, head started spasming, my neck, and it was sort of like a seizure. And I was like, okay, yep, it's time. And my heart rate was 200 and I couldn't get it down. So, anxiety, while people love to say, oh, it was just anxiety, oh, it was just stress, there are real physiological issues that are brought on by stress and by anxiety. And these real physiological issues can be damaging or even life threatening. So, a heart rate at 200 for 2 hours or more could lead to a heart attack or stroke, right? Real physiological issues. So I encourage you when you're feeling a stress related condition, don't just say, oh, it's just stress, right? It's stress, period. And stress causes actual physiological responses that we have to deal with. So, when you're dealing with anxiety, some nervine tonics are very beneficial, and relaxing nervines would be appropriate, especially those that have antispasmodic activity. So, I want you to think about passion flower, skullcap, valerian, and St. John's wort. And there are probably others, those are just the ones that come to mind for me. But think about nervine tonic, nervine relaxants, antispasmodics when you're dealing with anxiety. Okay. Then in depression, now depression's the opposite of anxiety. And so this is the obsessive disappointment in self or others due to past experiences and the inability to have handled or persevered as you had wanted to. So, whereas anxiety is the worry about the future, depression is the obsession with the past. The disappointment of how you might have handled the past causes the inability or lack of motivation to attempt anything else due to the fear of rejection, abandonment, disappointment, hurt, or feeling ashamed. Depression is most commonly associated with isolation, often self imposed, and the lack of feeling connected to friends, family, community, and a spiritual center. Antidepressants are now prescribed to approximately 40% of people. 10 to 20% of those people actually have major depressive disorder that needs chemical balancing. The rest are from situational depression due to life experiences that might not have been handled yet emotionally, right? So situational depression can change. I mean, we're all going to feel depression at some point in our life because of a situation that might have happened. And that's very normal, right? Now, it doesn't mean that we shouldn't help ourselves through that just because it's normal. But when depression goes on long term, then it becomes this chronic thing, right? And so we have to look at that a little bit different than we look at a short-term situational depression. But this might display as poor appetite, excessive desire to sleep, loss of interest in really anything pleasurable, decreased sex drive, fatigue. Um, they might say that they feel worthless, might have an inability to even just make a decision. And then, of course, recurrent thoughts of death or suicide attempts. I will um, caution you when you're working with someone who has depression, if you are not a clinically certified counselor or therapist and they express thoughts of depression, that you immediately refer them to get some help. So find a network of therapists that you can connect with that you could immediately refer someone to. Um, have the number of a suicide hotline on hand or any kind of resources for that, because if you are not a certified therapist or counselor, you are not equipped to deal with that. Okay. As much as we would love to think we're that compassionate, you're not equipped to deal with that. I, um, really felt like I could help people with depression. Um, and then my own daughter had been experiencing depression for quite a while. And she kept begging me to get her on a pharmaceutical antidepressant. And I kept pushing her to continue on the herbs, even though they really were not working for her. We were doing nutrition, we were doing herbs, we were doing vitamins and minerals, and she was still having a big problem. And then she came to me one night because she almost committed suicide. She did not attempt, but she had the intention and she had the plan of how she would do it. And when the thought was there to actually do it, it freaked her out. Thankfully, she came to me. And I had to step back and go, okay, now it's time. She needs help I can't give her. And I had to seek other help. And so I want you to understand that there will be times that it is bigger than you. And you need to have a network around you that you can turn to get help for yourself or for someone you love or for a client that you're working with, and that it's okay to do that. Now, when we're working with depression, that's not suicidal, then we want to think about, again, Nervine tonics, Nervine relaxants or stimulants, depending on the individual. So you have to make that assessment, right? So do we need to calm their nervous system or do we need to put a little oomph back in it? Okay. We also would look at bitters. So there's a lot of information about depression being related to digestion because 70% of our serotonin, which is our feel good hormone, is created in the gut. It's not created in the brain. So if we're working on depression and we're not addressing the gut, we're missing a huge piece. We also might look at antispasmodics, adaptogens, and hepatics. So those liver herbs. Okay. And then insomnia. So what's the cause of the insomnia? That matters. Do they lie awake for hours before they fall asleep, or do they fall right asleep, but they wake up a lot? And so the herbs that you'll choose for those two different things are different, right? Um, Also, do they have conditions like arthritis or asthma or thyroid disease or headaches or restless leg or, any of those things that might be interrupting their sleep because of other body processes. Sleep wake cycles, which are called the circadian rhythm, may be off and need to be reset. I love to tell people to go camping for a week with zero electronics. Like, do not even take your cell phone. 7 days in the woods with zero electronics. You wake with the sun, you go to sleep after dark. That sets your circadian rhythm. It's a fantastic way to reset the body. Not everyone's willing to do it, but It's fantastic because we are supposed to wake up within 30 minutes of the sun rising. We are supposed to get tired within 30 minutes of the sun setting. That's a circadian rhythm. Okay. I look at negative conditioning, the way people feel or respond to sleep. Do they have bad sleep habits or bad nighttime patterns? Do they have poor nutrition? Um, are they on pharmaceuticals? There's many pharmaceuticals that have insomnia as a side effect. Do they do a lot of alcohol? Do they do a lot of caffeine or nicotine? Um, are they on a lot of decongestants that are listed as non-drowsy? Those are have steroids in them. And so when I'm looking at sleep, I have to look at all of these things. So sleep is not a super simple, there's not a simple answer. But we look at some of the things we look at would be hypnotic. So those are really strong nervine relaxants. So I think hops as one of those, antispasmodics, nervine tonics, adaptogens. Um, some other hypnotics might be chamomile, lemon balm, catnip, valerian, and oats. And then things like muscle tension, we look at antispasmodics, anticonvulsants, anxiolytics, nervine relaxants, and tonics. And then, there's headaches and migraines, tinnitus. There's a few other conditions in your notes that you can read through and look at the different herbal actions that you would be looking for those conditions. So that was the nervous system. And I know Rachel will be talking to you about our HPA axis, which is really important, and adaptogens. And again, keep in mind that the nervous system is probably the number 2 system you're going to be looking at all the time when you're working with people. So I encourage you to reach out if you have questions, post your questions in Schoology also, and try some of the things that we talked about. And do your own observations about how these nervines feel within your body. All right. We'll see you next time.